Hi, we are here with Paul Nelson, president of the Erectile Dysfunction Foundation and founder of Frank Talk, the online community for men who want to know about erectile dysfunction. Nice to have you, Paul.
Thank you. Great to be here.
Okay, tell us about Frank Talk. How did you wind up founding this thing?
Well, I was a I was diagnosed with prostate cancer at the age of 46, and at that age, pretty much the only treatment anyone wants to do on you is surgery because just that's how the more aggressive cancers, that's how they tend to want to treat them. So I chose surgery. Um, and there was lots of support in the cancer world for having cancer. There was all kinds of websites for prostate cancer, all kinds of places to ask questions. And then, of course, after surgery, with the traditional side effects that almost every guy has, I assumed there would be some sort of supporting resource to learn about erectile dysfunction. And I got on the internet and discovered it was nothing but commercials. I complained to all my friends, who, of course, laughed when I said there was nothing for erectile dysfunction on the internet. Until finally my wife told me I might as well start my own website. So I started Frank Talk, and it is an online community. It's a discussion board. Men post their stories, their questions, ask for help. We have a few treatment pages, but it quickly grew, and we're now about 40,000 men a month are on there learning about sexual dysfunction from each other.
Tell me a little bit more about your observation that there's nothing on the internet about sexual dysfunction. On the face of it, makes absolutely no sense, right? Because it's not like nobody cares about sex. I think just
Right.
about everybody does.
Right.
So how can it be that there's nothing on a medium as big and all-encompassing as the internet? What do you mean by
Right.
that?
If you do a search for erectile dysfunction, you of course will get the pharmaceutical companies, the Viagra, Cialis, Levitra, and the goal of course, each of those companies is to make sure that you want to buy their product and their product's going to take care of everything. So I would say the information they're giving you is really just about their product. It doesn't say here that we understand where you are. It's not information. It's sales. Also on that search will come up the National Institute of Health, the Mayo Clinic, certainly several semi-medical sites. But the problem with those is, due to our litigation society, they are very restrained in what they can tell you because they don't want to get in the field of giving people medical information or medical advice. And so they will say very vague treatments, things like the treatments for ED include oral medication, vacuum devices, penile injections, and an implant. Uh, they may give a paragraph to describing what they're like, but there's no saying, by the way, here's how an injection works. Don't worry, it doesn't hurt. The stuff that really men want to know, you're never going to find on the information that's on these websites.
So it's not that there was no information, it's that your observation is that it wasn't balanced, it wasn't complete, maybe it wasn't fair. Um,
Right.
yeah, it
I,
was full of commercial bias, is what you're saying.
I use the term authentic information.
Yeah, no, I understand. And so I guess your wife picked up some sort of a activist strain in your personality and said, just go with it and give it expression. That's
Uh,
great. What was your purpose? I mean, did you have a defined objective as you began to design this Frank Talk portal?
of course not. I just I,
Okay.
I started this website, and I posted on a couple of prostate cancer discussion boards, and so it grew very quickly from men who were freer to discuss the sexual issues on this site as opposed to a prostate cancer site. Um, until one of the men who was on the board was an attorney, and he called me and said, "What are you doing here, Paul? What is this Frank Talk? What do you hope to do?" And I said, "I don't know." And he said, "Well, don't you think we should talk about this?" So he asked me what my goals, my visions were, and he said, "It sounds to me like what you're doing is a nonprofit." I was like, "Yeah, you're right." So that was when we became a 501c3, a nonprofit with the IRS. They were a little suspicious. They thought we were a sex charity at first. Uh,
Right.
but we finally became a patient education and support organization.
That's great. And how are they finding you?
Oh, because we've had no money for advertising or SEO work, everything is organic searches. If you search information like uh, surgeons who do penile implant surgeries. Frank Talk will now be right at the top of the page because we've got 20,000 topics on penile implants and surgeons.
Right.
So if men search for erectile dysfunction, they're never going to find us because it's filled with pharmaceuticals.
Right. I got it. So they're finding you almost by happenstance, although more and more frequently because you've got more content that may be relevant to what they're
Exactly.
looking for.
Exactly.
And what are they showing up for? What are the most common themes? What are the most pressing issues that interest them?
Um, the Most of them want a sense of hope because almost all the men that are on there come with it are somehow desperate. They're not getting what they need from their doctor or their hospital, or they may not have a doctor. They haven't addressed their situation medically yet, and they're frightened. Their wife or their girlfriend is upset. The sex life is falling apart. These guys are looking for hope. For what do I do? Somebody help me. I need a lifeline.
Right.
So that is the overwhelming thing that brings men to Frank Talk. A close second would be men for whom the first couple of treatments are not working, the Viagra, Cialis, Levitra, Stendra. They then may be saying, ooh, I have to do injections. What's that all about? They come to Frank Talk. And then, of course, penile implants is our largest constituency because those men it's the final decision. They want to make sure they know everything.
Right, right. And are they supportive? I mean, how do they relate to each other?
Unbelievably supportive. I can tell you in the 7 years of having this website, I've witnessed what I would consider one volatile conversation between two members. Other than that, the men are amazingly generous, supportive, kind, compassionate, thoughtful. They truly want to help each other. I have guys who, for example, had implants years and years ago, but they like to be on the site because they feel that they are generally helping their fellow man. And it's a very tight community of the men who want to get involved and post and build relationships.
Well, I think it's a really interesting history. Good for you, good for your wife for pushing you forward on this thing. It'll be very interesting to see where you go in the future. I think there's an increasing openness. I'm hearing it in lots of different circles, but your product, your portal, I think is unique. And again, lots of respect and all the best wishes. Thank you. And thanks for being on.
Thank you very much. Thank
Okay.
you.
All right.